My hello to all of you. I am Dr. Sachin, a practicing psychiatrist in Dwarka, New Delhi for last 10 years. I have done post graduation in psychiatry, MD psychiatry from Guwahati Medical College 2012. After that, I have been practicing as a consultant. I worked as an assistant professor in medical college, and I have been practicing as a consultant psychiatrist in Dwarka, New Delhi. And I am also teaching at DAMS, through which you are able to see this. So for the last 10 years, I have been mentoring students for counseling of NEET PG, and there are so many students whom I have guided about taking psychiatry as a career who have now become psychiatrists and are my friends and colleagues. Now, choosing psychiatry as a career, everyone had their initial doubts, so including myself, because of limited knowledge about this subject during undergraduation. Now, this knowledge part is compensated because you prepare for NEET PG and then you understand that these are the basic disorders in psychiatry. So, knowledge part is compensated, but our we have a limited exposure. In internship, we are exposed to psychiatry posting for 15 days, a few more days in undergraduation. For we do not have what exact exposure in psychiatry we are supposed to know what exactly we are doing in psychiatry. Okay, then we have old concepts about psychiatry, which are more of myths than concepts, which are more of myths. Psychiatry is all about working in a mental hospital. 60% of psychiatrists are not even going to mental hospitals. So we have old concepts. Psychiatrists are those people who only give shock therapy. Psychiatrists make dependent on medicine. Psychiatry is not a true biological science. So these are old concepts or myths. The current concepts we are not even well aware about. So we have to understand psychiatry as a branch of neurosciences. Neurosciences include neurology, neurosurgery, and psychiatry. And it is clinical neurosciences. It is a biological subject with psychological understanding. So overall, as a subject, you have to first understand psychiatry, what it means, where it comes from, what is a psychiatric patient, what do you expect from yourself as a psychiatrist, what society expects from you as a psychiatrist. So you have to understand all these things before taking this as a career. So as I always say, interest is much more important than scope. People ask me the scope of psychiatry. I say scope is in the person, not in the branch. In every branch there are top performers, in every branch there are not so good performers. Similarly, in psychiatry there are people who are doing very well, there are people who are just able to do okay. So it's not, the scope is not in the branch, it is in the person who is doing this branch. Okay, so but for taking this branch you have to have a very strong interest towards human behavior and its variations. You have to have some degree of patience to understand, to comprehend. It is not something very simple. Understanding human mind is not as simple as people presume it to be. So you have to be able to understand it. Now, if you're not sure whether your interest in psychiatry is just for reading or working, so please have a exposure in psychiatry before finalizing it for yourself. All of you have done MBBS from medical college. During that time when you did internship, you did not notice psychiatry properly. Maybe because you were not thinking about it as a career option. But now, if you go back again, work with a psychiatrist, stand in a mental hospital, have some exposure with a psychiatric patient, how are our patients coming? Because working in psychiatry and reading psychiatry are different. You understand mental health professionals are psychiatrists, psychologists, psychiatric social workers. We have research fellows. We have different things. So you need to get a hands on. Regarding the scope, nowadays we have a lot of scope regarding the emphasis on mental health by Government of India. We have a lot of scope in job and learning options abroad. We have a lot of scope as far as psychiatric super specializations are concerned. When I was doing MD, there was only one super specialization, child psychiatry, eventually geriatric, D addiction, CL psychiatry, psychosomatic medicine, forensic psychiatry, and whatnot. We have fellowships in so many branches in psychiatry. Since you are right now not a psychiatrist, so you may not be able to understand these terminologies, neuropsychiatry or forensic psychiatry. There's so many terminologies, but scope wise, there's a lot of scope. There's no bars in your growth, but you have to understand how much you are ready to give in for this branch, how much you are ready to learn with compassion, to learn with empathy, to learn with understanding a human behavior. Okay, so while choosing a college for psychiatry, it is not just a college, it is college versus hospital. We have a pure mental hospital psychiatry like EBAS, like Delhi, like CIP, Ranchi, which is one of the very good colleges, like LGP, Tezpur, Assam, versus we have a medical college psychiatry. Medical college psychiatry, like any other medical college departments, we have medical college psychiatry also. So this is something which is interesting. This is a pure psychiatry setup with less CL exposure. I'll not say no CL exposure. CL means consultation license psychiatry. That is the interdisciplinary play between psychiatry and other department. The advantage that you have in medical college is more consultation psychiatry license psychiatry exposure. And the advantage you have in mental hospital is more forensic psychiatry exposure or legal psychiatry exposure. Although there are certain places where we have medical college plus mental hospital set up together, like AMC Vishakhapatnam, Osmania Hyderabad, SMS Jaipur also has both exposure. There are many different um, institutions. Now, lastly, while deciding a psychiatry, language becomes a very important part in deciding your place of joining MD psychiatry, because it is important to know the local language of that particular area before joining psychiatry in that particular area. Okay, these are our basic things. Okay, I forgot about DNB in psychiatry. It is available in few places, like we have Asha Hyderabad, we have Inlas Vijayawada, we have Spandan Bangalore, we have Scarf Chennai. Some of them might have discontinued DNB. I'm not sure about the current year seats, but we have a lot of hospitals. We have Gangaram New Delhi offering DNB. We have IMH Amritsar. Now, DNB psychiatry is for people who are interested in psychiatry, but it is not in a medical college. I think KJ Somaya Medical College has DNB psychiatry. That individualized discussions we can have depending on your rank. This is a general discussion about psychiatry as a career, what you are supposed to know and what you are not supposed to know. Okay, so very basic things. If I have made some controversial statement, my apologies to all my colleagues in psychiatry. This is a general opinion about psychiatry as a branch. This may differ from my colleagues. So I'll summarize. We have limited knowledge, we have limited exposure, and we are bogged by our traditional old concepts. Interest is more important than scope. You have to understand that you are interested in human behavior. You have a patience to understand how complex human behavior works. In psychiatry, working in psychiatry is more important than reading. Hands on is very important. Government emphasis on mental health. We have a lot of scope, India and abroad. We have super specialization. You have to understand medical college psychiatry versus mental hospital psychiatry. We have to understand language as a barrier. We have to understand DNB psychiatrists in different institutions. For any further queries, you can get back to me, you can reach out to me, and I'll be helping you for psychiatry as a career. I have personalized slots available on DAMS Alpha app. I have personalized slots available on DAMS Alpha app. Anyone can reach out and book these slots and get back to us. Okay, thank you. That's all about it.